la jornada, Pia Perttula nos presentará la ponencia Las diferencias de género y la seguridad en el trabajo. You have the floor.
Okay. Buenos días. Good afternoon, everybody. I am Pia Perttula from Finland, and I think that the interpreter will, if you need to use headphones, but I try to speak as clearly as I can. It has been very interesting to hear that you are talking about work and family life balance. We are discussing about the same issues in Finland as well. And as a working mother, I also know the difficulties we are facing. And in Finland, the biggest newspaper, last weekend they had a big article about men who had decided to stay home with their children, and their women or wives had been going to work. So things are a little bit changing just after when my children were small. Then they were mostly women who stayed at home. I come from Finnish Institute of Occupational Health. It is a research institute in Finland, and we are doing some research and education and training for Finnish workplaces in order to prevent accidents and occupational health and in order to promote occupational health. And our slogan is well-being through work, and I think it's quite a good slogan because work should be something that gives us empowering, nothing that we go to work to get hurt or sick because of the work. So I'm proud to tell you our slogan. I have been working on occupational safety research since 2000. And we normally do our research in cooperation with Finnish workplaces. So we can hear the sound from workplaces through our studies. And as far as I have been conducting these studies, we take always into account this gender issue in our surveys. And today the topic is gender differences and occupational safety. I will approach through Finnish statistics, and then I will tell you how we have got these findings. Do they support other studies and so on. Most of occupational accidents occur to men. This is not a surprise for us. I took from Finnish statistics from 2010 to 2013 these figures, and we can see that these accidents that were in workplace, 66% of them occurred to men. In Finland, we make statistics. If we talk about occupational accidents, it includes workplace accidents and commuting accidents because of the compensation basis. But from the statistics, we can separate those accidents that occurred at workplace and those while commuting, which means the trip between home and workplace. In Finland, during these 4 years, more than 400,000 occupational accidents happened, and more than half of them were for men. And if we are thinking about how our workforce is divided, it's about 50% of the workforce is women and 50% of men. It varies a little bit during years, but normally it's like this. And here I have this other figure which shows the age of the victims of the accidents. The green pile is men, and we can see that young men are those who are most often involved in accidents. For women, those blue tiles, it is quite the same, stable, regardless of the age. And this same can be seen also if we are talking about traffic accidents as well. Young men, they are risky. And this is supported by other studies from elsewhere as well. If we are talking about those most serious accidents, those which lead to death of the worker, we can also see that men are mostly involved in these accidents. This green line represents men, and the blue line, women. We can see that there are some years that no woman was killed in a workplace accident, but for men the figure is much more sad. In Finland, the fatal accident number yearly has decreased during the last few years, and it's nice, but still there are too many of them, as we all understand. Half of occupational accidents occur while commuting. This line shows only those accidents that occurred while working. If we compare women and men on the length of the disability caused by occupational accidents, we can see from the top that women represent most of those accidents that lead to minor disability from 0 to 3 days, and men represent those that cause longer disability. We can maybe think that women go more easily to take to the doctor, to see the nurse, but anyway, the serious ones are mostly for the men. According to previous research, we have read several reviews that have been discussing about the gender issues and occupational accidents. The overall conclusion has been that men have 3 times higher risks of occupational accidents than women. And when we are talking about fatal accidents, men face 13 times more than women. This number differs a little bit regarding of the study, but it's something like more than 10 times anyway. And researchers have been thinking at why it is this way. One explanation, a simple explanation, is that men are doing more dangerous work, like they are working in construction, agriculture, and they represent a lot of accidents. But we are also thinking that do men take more risks than women? I will come to this part later in this presentation. Most of the studies indicate that men have increased risk of work-related accidents, and some of them show that 96% of fatal accidents occur to men. I just gave you some proof to these statements that I have been made, that other researchers have found the same things. The numbers differ a little bit, but the main message is the same. But when we are talking about men and women doing the same work, then we are in different solutions or explanations. Trelling did several years ago research for postal employees, those employees that were new to this job. And according to this study, women had increased risk of occupational accidents compared to men. And the increased risk for women was noted during their first year of employment. And this is quite interesting. Why women? This Trelling discussed that maybe women were those who were more likely to report minor occupational injuries. It is possible. This has been stated by other researchers as well. And Nielsen just published in Safety Science an interesting article about masculinity. He studied ambulance workers and slaughterhouse workers, which means those workers who kill animals and cut them, do this dirty work. Very masculine work, needs lots of strength. And according to this study, he said that men are more prone to violate safety regulations. But masculinity is more than just risk-taking, because he noticed that probably it's just that men are expected to be strong, to be able to carry heavy things, and so on. And if you are starting to show that do this safely or in more ergonomic way, it's maybe not as good as if you show a new equipment and you can use this to help and how to use the equipment. It may be more positive way of showing how to do it safely. In Finland, we do accident research after each serious accident by authorities at workplaces, and minor accidents we always teach that please do investigate all those accidents so you will learn, and this way to prevent them from occurring again. But as far as we have been reading the accident reports, we have noticed that often the main result is that the cause of the accident was a human error. And this means that then there is no solution because humans make mistakes. And in Finnish Institute of Occupational Health, we decided that there must be something behind these human errors, that it can't be the conclusion. So we made a study for warehouse workers, and in this study we tried to solve what is behind human errors. We found some interesting facts, and we made a survey for more than 900 workers, but when we are talking about gender differences, there were not so many. Women and men found the same things, mostly. Only thing that asking about, have you done something during the past year to prevent accident, women answered more often that I have not faced these occasions. And it's kind of interesting finding that why do they not notice? And the other question was that why accidents or incidents happen in your workplace, and compared to men, women answered more often there were problems with machines, equipment or system, or essential things are unnoticed. So is this that women are more careful, that they notice these things more often than men? We are just solving this, what is behind these answers. But the main thing, this had about 90 questions, this survey, but mostly there were no significant differences between men and women. And they are doing the same job in warehouse. They are driving forklifts or carrying items and so on. You have been talking about protection of pregnant workers, and during this Council directive we have been making research in Finland that how is this directive conducted in Finnish workplaces. The same study has been done in several European countries. I was the one who made interviews in this subject in Finland, and I interviewed those persons who work for trade unions, for both employee and employer trade unions. And the main findings was that no significant differences is in this issue between small and big enterprises. So the size of the workplace is not anyhow different, all behave similarly. And no measures were done to facilitate the compliance. What may be different in Finland is that women do not breastfeed at work. I do not know, do they here in Spain, but in Finland we have so long maternity leaves that after maternity leave is over, most people do not breastfeed anyway. The lady from the trade union told me that if a woman are breastfeeding her child, he quits it when she goes to work. This is what we found on this issue. As told, men are more risky. They face more fatal accidents, they face the biggest amount of occupational accidents, but there are two exceptions. The first one is commuting. The trip between workplace and home. Women have accidents more during the commuting. This figure shows that the blue part represents the women commuting accidents and the green part men's. Women have 1.3 times more commuting accidents than men. And especially women who are over 50 years are in danger. They have 2.5 times more than men. And most typical type of injury is falling. 75% of these are falling. And it is very easy to explain because in Finland we have a pretty much different weather conditions than you have here. Especially this time of the year is very risky because there is this black ice. No snow yet, nothing seems that is slippery, but still there is this black ice which causes. And one more explanation is that women use more public transportation for work. Men drive cars. So this is why women fall more often, because they have to move from home to bus or train or whatever. And the other one, where women face more occupational accidents than men, is violence at work. In Finland, we have collected the data since 1980s. We do it in certain years of periods. It's an interview study. We interview Finnish people, and we have noticed that since 1980s, violence in generally at work has increased from 2% to 5.5%. And this was until 2003, and even since that it has increased a little bit, but not as sharply as in this figure. But for women it has increased more. And especially violence at work is faced in health and social care and education, which means that it is those occupations where worker is directly in contact with client. For women, 50% of violence was threats, and over half of the violence were done by clients or patients. And in Finnish workplaces, they have sort of waken up for this, because it's a serious problem, and they are producing guidance and training for workers who work with clients. And what I normally do when I go to workplace where this kind of thing, especially for social care workers, that the first thing is just the physical environment of the person. If you are you are taking a patient to a room, then the first thing is that you should not be in the back of the room, and normally there is a table in front of you and the client comes there, and the client is very close to the door. But if the client attacks or threatens you, it's very difficult to escape from the back of the room. So the arrangement of the furniture should be in a way that the worker can easily escape if there is no alert system or anything available. But it is an easy way to improve the safety of these workers. Today is Friday the 13th. It's in Finland it is the National Accident Prevention Day. And every year we have one accident prevention day. It's always Friday the 13th. And we have a special theme for the day. And today it was haste. And we have been conducting an research that haste is significantly related to occupational accidents. And for this occasion today, I just checked the data that how do men and women differ. We have one question in this survey. How often do you have to hurry to get your work done? And these tiles you can see, green is men and blue is for women. And on the right side is the answer very often. We can see that women have to hurry more to get the job done. And what we found out, what is behind this haste, it is those psychosocial factors that you have been talking here today earlier. We found out that there were several things that if there is some problem on management of work, if you do not really understand what you should be done, and if there are some kind of discrimination or something like that, it is strongly related to this feeling of haste. And in the worst thing, the haste can affect to an occupational accident. So we have given a guidance what to do at workplaces to minimize haste. So it's something very logical, like arrange some time to do things that need concentration. If you are all the time interrupted, you know the hazard feeling it will cause. And if there are some problems in the workplace, inappropriate behavior or something like that, it also causes stress, which also causes more of the feeling of the haste. This is one more study. This is from my doctoral thesis a few years ago. We studied material transfer related accidents. You already talked about here that pregnant women should not be carrying heavy loads and so on. In this study, we found out that men are more involved in these material transfer related accidents, but women are more involved in other accidents. This is the case in Finland. But in one study I was conducting at stores, there were some meat coming from factories, and they are coming in high piles of boxes, and normally a woman at the store has to replace those packages of meat to the shelves of the store so the client can come and buy them. We once went and checked that how much is the weight of one of the box that is very high. It's above a worker's head, and it was more than 40 kilos. So you can imagine, you were talking about these kilogram limits that you have here, that what happens when a small tiny woman goes and tries to take this box away. And what we did is that we tried to inform workplaces that please do check what is going on next time when somebody is doing with these boxes. I mean, in factory they just load boxes. They don't care what happens in the store when somebody receives those boxes. But the logistic chain is something that needs to be reconsidered, especially when somebody is doing something for the thing that you have been in previous phase done. And in this case, it is the meat boxes that need to be emptied. And if a woman is doing this day after day, year after year, we know that sometime there might be a risk of an accident because of physical loading. Yes, I am in the end. Yes. In general, gender issues are not very typically taken into account on occupational safety questions. When we are discussing about the statistics, we notice that men are more often involved in occupational accidents than women. But that's it. What normally needs to be done after that is to check whether men and women are involved in different accidents. So this is how I think we can get to the point if there need to be separate ways of prevention. But what I also think that we need not always take into account the gender issue, but more or less we need to take individual features when doing risk assessment. Physical demands of certain professions affect the male domination, and for example, waste transport drivers that I have been recently studied, their work is physically really demanding. Not many women can do it, at least in Finland. Those waste cans are so heavy that it's very, very difficult even for strong men to move those. So it is very clear that certain professions for, let's say, a few years from now will be male-dominated. And in Finnish workplaces, we do not have very much differentiation on the basis of gender in occupational safety and health issues. I still asked my colleagues who are training workplaces that please tell any of the stories that are done differently for men and women at workplaces, and they couldn't. They said that they are treated equally and no different ways of accident prevention because of gender. But what I always point out, what is the most important is the safety communication. You have been talking here about training, and it's part of safety communication. What I think is important is to repeat after repeat, because it is the way to show that this is important. I understood that most of you are experts, so now there is an expert talking to other experts, but when we are going to a workplace level, they are so much involved in everyday work that safety issues do not always follow. But in order to get people work safely, I think that the communication is an essential role. It is not enough that we say once that please do replace this heavy meat box to the lowest, and please check that it is not too heavy for the next worker. And we need to do it several times in order to remind people and in order to show the commitment to safety. And when we are talking about risk assessment, I think that these individual features are important. There will be more men in the sandboxes and play cards with children and women working probably in the future. And this is why the individual features is important. Not only that, let's not make assumptions that because you are a man you can do this, or because of you are a woman you cannot do this. And I'm very happy to be here, and I hope you have got some ideas or something to develop in your minds and bring to Spanish workplaces. And if there are any questions or you want to discuss anything, I'm pleased to discuss about it. And gracias.